Wonderful. Thank you, everyone, for logging into our Wellness Wednesday live webinar. This is a platform focused on health and wellness with guest speakers and specialists answering your questions about physical and mental well-being. My name is Zarmina, and I'm delighted to be on this journey with you today. Do remember, you may share your questions for our speaker through the chat feature on this webinar, and we will get to them in the second half. A little bit about our speaker today. Dr. Saima Khawaja graduated from the Aga Khan University School in Karachi, Pakistan. Subsequently, she trained at the New York Medical College for Internal Medicine Residency and is board certified in internal medicine. She has extensively trained over the years in somatic experience for trauma healing, structural acupuncture, clinical homeopathy, and functional medicine. Her private practice is called the Holist Doc. She thoughtfully and jokingly refers to it as a place that she manages the whole list of patient problems that are not managed in a traditional 15-minute session by regular GP or primary care physicians. Thank you so much, Dr. Saima, for joining us on this session today. How are you doing?
What if you don't see what you don't see? And what if you don't see what you don't see? My concern is that what you don't see about the way your body functions and your health actually manifests. So that is the main concern. Thank you, Zarmina, and thank you for having me here today. And thank you all of you for listening in. My name is Dr. Saima Khawaja, as alluded to before, and that is what my practice and my life stands for. As mentioned, I'm the founder of the Holist Doc. I practice functional medicine and homeopathy. I treat the whole person and not a hole in a person. And our intention is to get you from feeling crappy to happy, awful to awesome, painful to pain-free, feeling terrible to terrific, and having acceptable health to exceptional health. We're destination health for you. I'm also known as the cancer solution doctor who provides the Hakuna Matata problem-free philosophy for cancer patients. The first one being my own dad. I feel that cancer should not be a death sentence. One should really not die before they actually die. And we take cancer patients from being fearful to fearless and hopeless to hopeful. Again, I'm Dr. Saima Khawaja, your health solution doctor. And thank you once again.
Thank you for being with us, Dr. Saima, and sharing that about yourself. I think we all are really wondering and would love to know how and when did you get into what you do today?
So I still remember vividly, it's the summer of 2008, and I'm sitting in my Washington, D.C. Office. There's a huge glass window on my side. It's late in the evening. It's one of those another long days. And I'm writing a prescription, a narcotic prescription. And I just put my pen down. And I realized that I simply can't do it anymore. I know the system is broken, there's corruption. And for this patient who's sitting right in front of me, my best solution for them is to give them another narcotic prescription for their pain. Something is wrong with this picture. That was my defining moment. And now what my life and practice stand for is that there's an entirely different way for people to deal with their health, their challenges, and that's what I'm here to talk about today. So we're going to basically go over three things. There's a three-part structure that I have in mind today. We're going to help you understand a new paradigm about your health. We're going to help you understand some unique distinctions about fibromyalgia. And we're also going to give you some kind of a mission and plan to go forward.
Thank you. That's wonderful. So before we jump into the new paradigm of health, you gave a wonderful example of not treating the whole in the person. Can you tell us a little bit more about what you mean by that, and how is that concept a new paradigm of health when it sounds so, when it sounds so much of a given and a basic fundamental? Why is it so different?
So let's put it this way. Mankind has confronted disease since time, beginning of time. And they've looked up to the surroundings and environment, looking for healing. And over the years, like a Chinese whisper, we now don't look at nature, environment for solutions, but we look at the plastic bottles or some kind of container, and are quite far removed from nature, which is truly nurturing in its essence. So when we talk about a whole person and not a whole person, what I'm really trying to say is that I'm not interested in treating one little part of you, which means, say, you come with, say, my finger hurts. Now, the finger hurt could be a reflection of many things. So I need to look at the entire individual rather than just part of that person's problem, because it could be connected with something, many things actually. So we should never look at somebody in a casual manner, but every person is a whole individual that carries with him or her a whole background, a whole story, and we must not overlook that. So that is what I mean when I say we treat the whole person and not a hole in a person.
Wonderful. Thank you for breaking that down. I think we're ready to learn about the new paradigm. Would you please tell us what that's all about?
So like I mentioned that, we have stopped looking at our environment around us and see what's out there. And that has led to most of us become very hopeless over time. And we no longer believe in true deep healing, as we don't offer cures. I mean, look at the mainstream medicine, which I would refer to as the hospitals, medical clinics. And these are the places where patients go for their problems. But if you really pay attention, in these centers, they are the places for disease care management and not truly health care. Because if you keep on taking medicine, that doesn't mean that you're getting healthy. And I would quote an atypical figure over here that you may not have heard of. He's the first caliph of the Muslims, actually. His name is Abu Bakr Siddiq. And he has an amazing quotation that I came across, which really blew my mind. And I said, wow, this is so profound and so smart. He said about 1400 years ago, you cannot have three things from three things. Number one, you cannot have health. Oh, sorry, you cannot have wealth by hoping. You cannot have youth by dyeing your hair black. And you cannot have health by taking medicine. So imagine somebody is popping pills day in and day out. That doesn't mean that the person is healthy. So every medicine you take either blocks a receptor, block an enzyme, blocks a pathway, and over time it will give you problems. So that is why I feel that it's very whole-oriented and not whole-oriented. So the new paradigm of health is actually not new. It's pretty ancient. The ancients were really open-minded, and we need to be integrative, and we must be respectful of other traditions. And from a scientific approach, in my understanding as a physician, we need to be cause-oriented, which I would call functional medicine, where we really look at the root cause of health problems and address them at the cell level, like the micro level, where we look at all the pathways, nutrients, environment that support the normal function of a cell. And of course, when you take at the cell micro level, it translates into the macro level at the entire sound body level. So that's what it leads to. This is what the paradigm is.
Thank you. That's a great introduction and setup. And I think let's jump right into it. What is fibromyalgia? Share your thoughts on it, and why is it known as the invisible disease?
So I love, like, you can see my approach of dissecting things out. I love languages, and I like to know the meaning of things. So let's look at fibromyalgia. What does the actual word mean? So it's actually a Latin word. And if you dissect it out, break it out, the word fibro means fibrous tissue. Maya means muscle, and algia means pain. So fibrous tissue, muscle, pain, that's what it means. And so basically, this entity called fibromyalgia, I will not use the word disease, because when we say disease, we actually talk about some pathological finding per se. So this is what we call a syndrome, which means a constellation or collection of symptoms and problems that patients present with. So the three main symptoms or problems that patients with fibromyalgia have, in the constellation of three things. Number one, there's widespread painful muscle pain. And then there's significant fatigue. And then there's cognitive or some mental, fibro fog, we call it, like an unclear brain. So the three main things, but there are also other, symptoms along this whole, but these are three main ones. And the others are like impaired sleep, tooth grinding, a lot of gut symptoms like, constipation, diarrhea, alternating or together, mood disturbances like anxiety and depression. And once upon a time, they talked about 18 pain points. which no longer is in the definition because the definition has gone over a lot of changes over the years. The first one was published in 1990, actually, by the American College of Rheumatology. And it was further modified and substantially, modified in 2000, then 2010. And then in 2016 was the last, revision that came, which basically is the one that I mentioned that, the three main thing. And there are no 18-point pain is not no longer considered as, the part of that element. Now, I want to make a clarification over here that people confuse painful points with trigger points. And the two different things, I want to clear that because some people may have trigger painful points, which is more of a myofascial kind of a pain. And that actually is a physical entity where you can actually feel focal, palpable knots in the muscles, which when you actually press them or you even do needling on them, they actually get released and they're gone. Whereas in fibromyalgia, you actually are just overall tender. There's no specific focal knot that you will appreciate, which is the trigger point. So I thought I would mention that if any of the listeners, they have trigger points, they don't kind of confuse that with the painful, just pain in general. And why it's called the invisible disease? Well, it's called invisible because fibromyalgia doesn't really actually affect any major organ. If you were to go to your regular GP or primary care physician, and if they do routine testing like CBC or a basic metabolic profile or x-rays, nothing will get revealed in those tests. Not even an ESR is elevated or CRP is elevated sometime in these patients. So that's why it's called the invisible disease. But patients are actually experiencing the discomfort. In fact, about 3% of population in the entire world is affected with this thing. And in the US over here, we have at least 10 million people who are affected with that. So imagine when you have pain all over your body, you are mentally fogged, you're all fatigued out. Imagine the loss of productivity with debilitating symptoms it can create and what a life it becomes. It's ironic that women are mostly affected if you look at the historical perspective. And when you dive deeper into the history, you see a lot of emotional trauma, which could be physical, sexual, other things kind of thing, or different kinds of traumas. So from the mainstream medicine perspective, what we would do obviously first take the history and look at the different symptoms that you present with. And of course, this examination, you look at the painful muscles in general and not the trigger points. And then of course, like I mentioned, when you do the investigation in the routine realm, in the mainstream realm, you don't find anything wrong. So the main focus of any physician who foresees these patients is to make sure that there's nothing big that they can miss out on. Like there are other rheumatological diseases which do present with pain, like rheumatoid arthritis, like lupus, like my multiple sclerosis. So we want to make sure they're not there. And really the treatment is like pain management, NSAIDs like ibuprofen, opioids, which don't really take away the discomfort and pain altogether. And then muscle relaxants, gabapentin, Lyrica, antidepressants, sleeping medicine. They're all, as I mentioned, they are like, patchwork treatment. But what is happening underneath at the cell level is not being looked at. Now, recently, low-dose naltrexone is something that has come out on the horizon, which is basically an antagonist for the opiate, receptor, endorphin receptor. And how it functions, it attaches to the receptors and releases these internal endorphins, which are the internal opioids. Hence, it gives rise to ease in the discomfort and the pain is gone. And it also actually modulates the immune response. And it actually helps the immune response by suppressing the cytokines, which are the inflammatory pathways. It suppresses them. And from the cancer perspective also, low-dose naltrexone, it actually works at the NF-kappa B, which is another, mediator in the inflammatory pathway, which promotes, cancer. So low-dose naltrexone is an amazing thing that I have also used in my practice. I'm not sure whether it's available out. I'm sure it should be available, in the other parts of the world. But this is a promising thing. And of course, the mainstream medicine is also appreciating that when we give them all these pain medicines, they're not getting better. So now you start seeing in the mainstream literature also talk about stress management, mindfulness. They even talk about acupuncture. And one thing I want to mention of it, there was an NIH study, the National Institute of Health, with the Integrative and Complementary Medicine Department of that organization. They did a study on Tai Chi, actually, on 226 patients. And it's published in the British Medical Journal. I'll be more than happy to share the link also. And Tai Chi actually is an ancient discipline. It's a Chinese discipline, which is rooted in, martial art, and it focuses on your physical, psychosocial, spiritual, behavioral elements to promote health and fitness. So it's interesting, how it's again so holistic, and this is something which mainstream is now coming, to promote. So it was very refreshing for me to actually review the study. But of course, from the same thing, from the functional medicine perspective, when we look at from that perspective, we don't do the routine medicines, but we basically dive deeper at the cell level. And the hallmark that we see is the suboptimal energy production at the mitochondrial level, which is seen. And in the hormones, we see more catecholamines release and lower serotonin levels. So if you do the functional medicine approach, there's a lot of hope to actually find some tangible things that you're going to begin to work with.
Thank you. And you touched upon the relationship of, an underlying cause. So could you tell us a little bit more about the relationship between fibromyalgia and gut health? What role does that play?
So Ibn Sina, he is called the Prince of Physicians. He said, death begins in the colon. So I would ask a question, what organ of the body produces 3/4 of the neurotransmitters? The gut.
Really?
What organ of the body contains 2/3 of the immune system? The gut. What organ of the body contains 10 times more cells than the rest of the body? The gut. And what foreign inhabitant of the body has a metabolic rate greater than the liver? The gut. The gut is actually called the second brain because of the plethora of neurons inside the gut. So the point is that if you're experiencing all kind of bloated, gassy feeling, constipation, diarrhea, I would not be surprised if we look at the cell level and start diving deeper as to what is happening over there and find something. Actually, the McGill University in Montreal, Canada, they actually recently did a study, which again, I'll be more than happy to share the link. And they noted that the gut microbiome in fibromyalgia patients is different than regular women. And one of the researchers, Dr. Amir Minervi, actually over there, and I found it very interesting. If you look at the mainstream medicine, most of the testing is more pictorial. For example, cardiac cath, they inject a dye and take a picture of the heart vessels. What is endoscopy? They pass a camera and look at the physical, manifestation of physical appearance of the, food pipe and the stomach lining. In colonoscopy, they look at the physical appearance of what the colonic mucosa looks like. If you look at the CT scans, again, a picture of whatever organ or whatever section of the body you're looking at. Look at the MRI, again, it's a picture. So all these are pictorial assessments. So when we talk about functional medicine, it's not pictorial. It actually is very dynamic because we're looking at the functionality of the cells and how their functions are going about, which we can look at and assess and actually make meaningful interventions to actually support those pathways and enable them to function right.
Wonderful, thank you. That's very helpful, and I think that just re-emphasizes the importance of gut health, essentially. And you touched upon functional medicine. So, how can one, approach complex health issues from that approach, from the approach of functional medicine? And is it difficult to adjust to that, if you're perhaps raised on or so accustomed to what you call mainstream medicine?
So I actually find functional medicine approach to be a very easy approach. It actually puts ease in the process, takes away the difficulty because it doesn't look at the labels. It looks at the root cause. Like, if you know this is a cup, then it's like what the cup looks like. Now I can call it glass, but if you know what it looks like, that's what matters, right? So similarly, I'll give you an example. Say somebody has cough. Now cough can have different reasons. If you have a congestive heart failure and you got water in the lung, you can have cough. If you're asthmatic and your airways are narrowed, you can have cough. If you have an infection like a sore throat or pneumonia, you can have cough. If you have allergy, you can have cough. If you have acid reflux, that can also manifest as cough. If you have, God forbid, you inhaled a foreign body like a peanut, you can also have, a cough in that situation. So do you think giving a cough medicine like guaifenesin to each of these patients would be the appropriate solution to their cough? I would ask you, Zarmeena. Do you think that would be the
Probably
appropriate reason?
not.
Uh,
Probably not.
so because in congestive heart failure, they have water in the lung. So the treatment should be to give a medicine to remove the water from the lung. So a diuretic would work. In asthma, the solution is the airways are narrow, so we need to give them a bronchodilator or airway opener to allow them to have ease. So a bronchodilator would actually be appropriate. If we talk about infection, maybe giving them an antibiotic will actually take away the cough. If they have allergy, giving them anti-allergy medicine to undo that, or even the exposure, or giving some kind of anti-allergy medicine, that would take away the cough. If they have acid reflux, maybe sitting upright, or giving them a acid suppressing medicine at that time to take away the discomfort will actually take away the cough. And God forbid, if you have a foreign body that inhale a peanut, no amount of cough medicine will do anything to it. In fact, you'll have to do the Heimlich maneuver, press them in their stomach and have them cough it out, the peanut, and that will definitively take care of the cough. So like I explained to you, the outset symptom is cough,
Right.
but the inside pathology is totally different in each scenario. So you can't look at anybody with joint pain and say, oh, that's what it is. Because a joint pain could be a reflection of many other things. We know that in many inflammatory bowel disease, they can have hip joint discomfort also. So the point is that we cannot look at just the surface symptom. We need to dive deeper. And when we talk about functional medicine, again, we go into detailed history. We look at relationships. We look at traumas, and interpersonal relationship. And of course, when we look at the scientific approach, we look at the energy production pathways. We look at the mitochondria, digestion, detoxification pathways, immune system, hormones, brain health. We look at all these aspects of an individual. And I can actually, share over here on my screen some of the tests that we can actually do. Let me, so this is the, sorry, this is something else. Cancel. Can you see this thing?
Yeah, I can see the
The
diagram.
steroidogenic pathway. So this is a test that looks at the DNA evidence of the gut health, where we look at the actual bugs down there and the different fungal infections, and of course, the different intestinal health. This is the entire pathway of your body, where we look at, the mitochondrial pathway, neurotransmitters, detoxification, methylation pathways. So we dive deep in the cell level. This is where we look at, the different nutrient, deficiencies of the body. This is where we look at, the hormones of the body. And of course, we have the sample report. This is where we can look at different antibodies to different organs that you can make from the immune system perspective. We look at the leaky gut to see at the gut lining level, are your cells joined together or they're broken? So what is the integrity of your gut lining in the lumen of the gut? Do you have good enough amount of immunoglobulins there? So all these things, and of course, we want to look at the entire, hormonal pathway. What is happening at each level, and why are you not making the appropriate sex hormones or, stress hormones? So we dive deeper into all these things to have a better idea about what is going on, with a person. So that's why the functional medicine approach is a way more, a comprehensive and a very deeper approach. So there's nothing to be hopeless about, but it's really, you can begin an amazing journey and, explore yourself.
Thank you. That was very hopeful end to that message. Dr. Saima, we hear this terminology of holistic health a lot. I think we're starting to hear it everywhere we go, whether it's an advertisement for a clinic or some vitamins or, anywhere you look at in the health and wellness space. Can you truly define what is holistic health?
So I'll give an interesting example. Let's look at a marriage. You look at a husband and a wife. Husband has different attributes that he brings to the relationship, and the wife has different attributes that she brings to the relationship. It's not a marriage if it's either one husband or just, the wife. If they are separated it doesn't really, bring that wholesome to the picture, because both have their amazing attributes, and they both, when come together, they make a completeness in that picture. So similarly, I feel that there are so many traditions of healing out there. When we talk about holistic, we're trying to say that we look at all aspects of human being in assessing their issues, rather than just look at one part of the problem. So, like I said, they're complementary, and they're not, separate from each other. Now, and there are many traditions out there. I would talk about acupuncture, for example. It's a 5,000-year-old tradition, Chinese tradition. Now, Chinese, I believe they're very wise people. They said 5,000 years ago that kidneys make blood. And today we know that kidneys release a hormone called erythropoietin, which actually stimulates the bone marrow and actually makes blood. How did they know that? They didn't have laboratories over there, but they knew that, kidneys make blood. And when people have kidney failure, they become so pale and they don't make blood. Now, even if you look at the large intestine, meridian, it actually has immune points in Li10 and Li11. If you look at homeopathy is an amazing tradition which looks at likes cure likes. What is your vaccine? You give a small dose of something that can harm you if given a big dose. So similarly, phosphorus, for example, in the large toxic dose, it will burn you and really burn the entire body and cause bleeding all over. But in a very diluted dose, actually will do the opposite. There are so many other, herbal medicine traditions like Ayurveda, Unani medicine, Greek medicine, Hikmat. They're all amazing, traditions which are looking at different herbs and elements of the earth in their healing. Look at many mind-body kind of, approaches like mindfulness practices like yoga. And I really want to share about somatic experiencing, because it was one thing that I had a lot of trauma in my practice. And it's really rooted in our body that a lot of us, when we have anxiety, depression, we think we need to find a pill out there to pacify ourselves or control our symptoms. But what I learned from this tradition is that to heal trauma at the deep level, we actually have amazing resources within our body in the parasympathetic and sympathetic nervous system to actually heal. So you don't have to run outside, but you can literally tap into your own body's resources and create healing. So, I mean, if you look at the willow bark, for example, in the herbal medicine, I just feel that there's so much balance in nature. Now, what is willow bark? It's actually, your salicylic acid. But in the willow bark form, it just does not have only salicylic acid. It has multiple other components. It's like they're all holding hand with each other. So if you like, for example, centripetal force, centrifugal force. If either of the two forces is dropped out, you either get sucked in or thrown out of the orbit. So similarly, in the willow bark form, the salicylic acid is surrounded by so many other elements which are like holding its hands and not letting it transgress. If you take one pill of aspirin, which is extracted out of the willow bark, you can have bleeding. Even one aspirin can cause, a hole in the stomach. But if you actually took willow bark, it's in balance and it will not actually create the same negative effect that can even one aspirin could do. So my point is that nature has a lot of wisdom in it, and nature has balance in it. And we must show respect to the amazing wisdom in nature and approach it with the respect and regard, and not just give it a casual look and a glance.
Thank you. Well, Dr. Saima, I think this is a perfect turn to open the floor to questions. We are already getting some questions. So I'm going to jump right into it. And I think it fits in very nicely with what you've just explained. In your esteemed opinion, what is the best treatment for fibromyalgia, and what tests should be conducted to ascertain if you have fibromyalgia? So I think this is largely to do with the diagnosis of it, and then the suggested treatment.
Give me 1 second. This is the sun coming. So I was,
No
so
worries.
like I said, from the functional medicine perspective or from the mainstream perspective, if you have fibromyalgia, the routine testing probably will not show much. So, there's a funny quotation. There was a robber called Sutton, and they would ask Sutton, Sutton, why do you rob banks? And Sutton said, that's where the money is. So we need to go where the money is, which means we need to go where we'll find the problem. We'll be able to identify the problems. So let's dive deep at the cell level because the body is saying something. It's not producing a discomfort out of in a vacuum. So if we dive, if we're the surface, we will not find, which are your regular routine CBCs, CMP, routine X-rays, which are not showing much. So we need to go at a deeper level. And I shared some of the testing with you that you can do. Look at your gut. You can do more metabolic assessment, and you can do organic acids. You can do all these tests actually and find a lot of things to work with, especially the mitochondria level. If the mitochondria, which actually are the powerhouse of your body, if your mitochondria are not working right, imagine they are providing energy to the entire body. Every cell needs energy. And if they're not making energy efficiently, why would you feel bright? Is it a surprise that you're feeling mentally fatigued, mentally tired, you don't have the energy to do things? Of course, it's real then. So we need to support the mitochondria, but if we don't look at the mitochondria, we won't even find the answer. And of course, like I mentioned, that you can take things to alleviate your symptoms, but I would say that we should definitely, while we're alleviating the symptoms, we should definitely start to work up and look at the root cause level. I don't discourage that you don't take treatment if you don't have any other avenues, like you can take low dose naltrexone, take acupuncture, do all the other things that your doctor is recommending. But if you're not finding, solutions to your problem, then I would recommend that you don't just give up, but say, okay, it's like you knocked on one door, it didn't give you the answer. You knocked on another door, didn't give you the answer. It only means that you're knocking on the wrong door. So knock on the door, will get the answer, and you will find it. So remember, it's a whole world out there, and you probably have not looked at the entire world for your answers. So I encourage you to be not hopeless, but be hopeful and look at viable options. And I would say functional medicine is an amazing option to dive deeper and look at, your body in a very comprehensive manner and actually find answers to your problems.
Wonderful, thank you. We have another viewer who says she, I believe, had or may have been diagnosed with fibromyalgia and is asking, is temporary paralysis associated with fibromyalgia and the pain caused by it? Is that a common symptom?
Not really. Paralysis is not something I would think. And if they do have paralysis, then I would recommend to take it a little seriously. There are sometimes actual real situations where you can have transient viral episodes also, which can give rise to those things. So they should really seek, again, make sure that there's no organic reason for that thing. When I say organic, which means first make sure, like I mentioned, if somebody has aches and pains, we'd want to make sure they don't have a rheumatological disease that we're, missing out on, like they have lupus or multiple sclerosis or rheumatoid arthritis, something like that. We don't want to be missing out the big ones. And once those are out and ruled out, then we can say, okay, the big major ones that can be really problematic to miss out, they've been ruled out, and now we can, look at this individual. Paralysis, no, I would not say that is one of the common features, and I have not seen in my review of my fibromyalgia any mention about paralysis.
Okay, wonderful. We have another viewer asking that Dr. Saima, you mentioned about uh, fibromyalgia as a syndrome instead of as a disease. Is it a syndrome that is underlying that can be triggered and flare up from time to time?
Yes, it can be, because again, when we say about flare up, it basically means like you've heard of a cold sore people get, right, on the lip here and there. And they're typically association with a viral infection. And when herpes virus viral infection, and when does it come? Stress. Any
Right.
kind of a situation where your immune system is depressed, it can trigger. So you can have, ebbs and flow of, the disease, where sometimes a trigger happens in their life, a stressful situation happens, and the symptoms are more enhanced. And then at other times, the symptoms can be less enhanced.
Great, thank you. Thank you for that. Our next viewer is asking, what can fibromyalgia often be mistaken for? So I assume they mean a misdiagnosis in this case.
Like, actually, more than mistaken, it can be missed. Let's put it this way. Uh, but mistaken, like, chronic fatigue syndrome is another one where people can, be mistaken. If they have brain fog, then, there could be other, like SIBO can also have. So my point is they're all very interconnected, because fibromyalgia can have gut issues. So we, from the mainstream medicine perspective, we are used to naming things and then keeping them localized in one organ per se. Whereas I feel that we are an entire body where everything's connected to everything. So you may have one thing in one part of the body which is affecting another part of the body. So somebody with heart disease, for example, diabetes, may not even have chest pain, and they could be having a heart attack. So that's example of a situation where they can look very atypical and may be missed. So yes, fibromyalgia is a syndrome. It's not per se disease because we don't find pathological evidence from the routine surface, I would say, because I'm aware of cell level testing. So I would say the surface level testing is unremarkable. So yes, it can definitely miss for something else, and can be confusing because there are overlapping symptoms with other things also out there. Like somebody's more enhanced, issue may be bloated, gassy feeling, and they may be having IBS only, and they may not have aches and pains, or they may have only one little part of the body which has an ache and pain. So they're all interconnected, I would say. And again, from my perspective, like I said, the whole list talk. I'd never look at one aspect. I'm always interested in the entire picture. And if you look at the entire picture, to be honest, it doesn't matter what the label is because you're interested in the entire picture.
Great. Our next question is fibromyalgia genetic, and should I be concerned of passing it on to my future children?
Actually, it's not genetic. Yeah, I've kind of come across that, concern, but no, yeah, there's no gene. If you were to say no gene associated with that. And I want to clarify one thing over here as gene or genetic stuff is being discussed. Now, in 2010, a landmark paper came in Time magazine called "Your Genes Don't Determine Your Destiny." How amazing. It completely, throws off anything that you believe, because we think, oh, it's doomed. So we've learned that there are actually epigenetic markers on top of the genes, which are called epitopes.
Okay.
And these are actually turn on and turn off buttons. And based upon the exposure from the environment, these genes can be turned on and turned off. For example, we all have cancer genes. How come we don't have cancer? All of us. It is because by our environmental and lifestyle exposures from the environment, those are turned off. And when something happens, they get turned on. And then and we are very well aware that, there are specific genes associated with that. But I want to say that there's always a turn on and turn off button on top of a gene. So the switch goes on and off. So there are factors that you can use to keep them turned off. And there are factors which can be careless factors, that you can turn them on. So there's no gene for fibromyalgia. And I just want to say that genes are predisposition. They're not death sentences. I want to say that you're not condemned to some kind of a diagnosis. If your father has diabetes or mother has diabetes or somebody has stroke, heart attack, please don't think that you are also doomed and you will have stroke and heart attack. They've done twin studies. If genetics was a thing, then they would find exactly the same thing happened to both the twins, right? But since the twins led different lifestyles, they were able to appreciate that they had different outcomes and different expressions. So I give the example, say I've got a lion in the back of the room, and I take a little pen and start poking the lion. Mm-hmm. What will the lion do? It'll come back and try to attack me because I'm disturbing the lion. But if I let the lion stay in a Zen mode, he's all nice, fed, and he's meditating, and I don't bother the lion will not come back and pounce at me. So let's keep our pens where they belong and not poke the different genes of the lion so that doesn't come back and pounce at us, but it stays in a Zen mode and is peaceful and serene. So yes, we should keep our genes calmed down, and there are ways in lifestyle and all the stuff that we can definitely keep them calmed down. Great, so there's hope. That's what I'm saying. There's a lot of hope. Actually, it's a beautiful message that if you get your act together, you can write a different destiny for yourself. It doesn't have to be the same destiny as somebody before you.
Absolutely. We have somebody asking a very specific question. I get pain in the middle of the night and I can't sleep on my side. I have terrible pain during the day, and the pain is mostly in my lower legs. What should I do?
That's a pretty specific question. And if I obviously there's certain thing that came to mind. I mean, if they're in the legs, there could be definitely could be some nerve root issue. If you have something happening at a specific angle, it just means there's something anatomical which may be impinging upon a nerve or something. So like I said, you need to first make sure there's no anatomical stuff happening, which can be addressed. The person can look at some stretching exercises, look at some simple things like that. And there's so many things, like when you describe that, I thought a lot of homeopathic medicines in my mind, like hypericum, which is like, if it's a sciatica like kind of pain, you can actually use hypericum for that. If you want to use some anti-inflammatory effect, you can actually use a bryonia. If you feel that after sleeping for a long time, you're kind of stiff, and now when you wake up, you feel discomfort, then you can use Rustox. So there are a lot of things that you can do, but again, this would not be the appropriate place to kind of discuss that, because again, they're just 3 sentences and it will be difficult to make any assessment based upon those sentences. So a little more detail about the history would be preferable, where we can actually have more specific information and actually give more specific recommendations.
Absolutely. We're getting this always happens in every session, with the pandemic and the global situation we're facing. There's a question, very relevant to that Dr. Saima, as a functional medicine, in your approach, where does the vaccine fit in? So what would your thoughts and professional opinion be
The
on that?
vaccine over there, or just
In general, but I'm assuming we here have the Sino, something, the Chinese vaccine, that's what we have here. But I think we know that the Pfizer vaccine is coming very soon. So I think most people are asking about that and interested in that.
So, first of all, I actually wrote a very detailed article on my website. So if you're interested in a little more detailed thoughts, you can please feel free to go to the website, theholelesstalk.com, and there's a COVID-19 tab in there. And I wrote an article right there at that time talking about my thoughts. So here's what my thought about is, and I'll say it's like a general thing, because obviously COVID is a very touchy subject for a lot of people, and again, give out to a lot of aggravation here and there. But I would say, as a functional medicine physician, my thing is that anything can happen to the body, but at the end of the day, and I shared that in my article, that when I was working in the hospital, seeing ICU patients who were very sick, we would give them all the stuff medicine that we thought that would help them out, and then after that we would just back off, because now we're waiting for the body to start doing something, right? And what is that unknown thing in the body that we are waiting for to start doing its stuff? It's the immune system. It's the immune system. So the immune system is the one that actually eventually helps you clean up the virus from the body. The antibiotic is really a nudge. It kills, but if the killing happens and all that debris and all the stuff as a the outcome of the killing keeps on accumulating in the body, it's a big problem. So the body has to clean up, and it has to and those natural killer cells are the ones which eventually gulp down, engulf all these viruses and actually remove them from the body. So what saddens me in the entire picture is that all over the world, which actually is amazing, I believe everyone has a big blind spot, a big blind spot. The entire world has only the 3 recommendations: stay away from the other person, wear a mask, wash your hands. That's it. And there's no talk about anything else. And it really behooves me. I'm shocked that in first year, second year in medical school, we read about the entire body. We look at all the cells, and we know how the body functions, but we are not at all focused on how we can actually support the human body to actually, fight the virus. So your immune system is the one which eventually will fight the virus. So does it not make sense to actually, support the immune system and enhance it, so that you can actually fight the virus because you've heard that a lot of people don't have symptoms, and there's some of them who have symptoms. My own brother had COVID in Pakistan. He was sick for 4 days. He went to his GP. didn't get any good, answers. The moment I got in touch with him, I felt like hitting him on his head with a shoe that for him to tell me. And I basically told him to take 4 homeopathic medicines, which he took. And within less than 24 hours, his fever broke. He was up and about and walking around. And my brother-in-law also had it, and I also recommended him. And within 24 hours, he was fine. So the point is that it's very simple and easy things you can do to actually support your immune system. And even in the mainstream, in the holistic realm, you can use so many things which are effective, easy, and cheap, and can help and support you. Now, when it came to, there was a lot of controversy about like uh, the chloroquine, remember? And so my point is that if you actually look at how the COVID-19 virus actually goes inside your body and does all the chaos, when it first comes in, it hijacks the DNA of your cell. It replicates. And then once it reaches a critical mass, then it starts a cytokine storm and starts to attack the entire body. So chloroquine actually was studied many, many, many years ago in many other studies, long before this whole coronavirus thing came. It is an ionophore, which means it opens up pores inside the cell. And zinc actually is an amazing thing which inhibits the RNA-dependent RNA polymerase inside the cell of this virus. So if you give zinc, zinc will inhibit the RNA-dependent RNA polymerase, but you need large amount of zinc to enter the cell, like a gush of it. And that is where the chloroquine helps to open up the pores and let it gush in and go and inhibit the RNA so that it doesn't replicate. So there's a role for chloroquine in the initial part of the disease versus latter where it's too large and now you definitely need the ICU support. Because there were studies done in the initial part of this whole COVID-19 pandemic that they looked at ICU versus non-ICU patients. And they saw that the non-ICU patients, of course, are less sick than the ICU patients. They're not as sick. And so they saw that this model, this regimen worked a little better versus the one in ICU. So they realized that let's look at the mechanism first over here and see what is happening at the cell level and then make an intelligent decision. So I would just say we should not be so anti everything. We should look at with, some kind of sanity, not get excited and judgmental and upset over teeny little things, but really look with logic and see, okay, what different organizations or governments have in mind. I don't know, but I feel that if you do in a methodical manner, look at what is happening at the cell level, it'll give you the right answers. But from my perspective, I would recommend, please support your immune system, support your immune system, support your immune system. And one of the best you can do is sleep early, because sleep has two parts. The slow wave sleep is the initial part of the night, and there's rapid eye movement sleep, which is the deep sleep part of the night. In the initial part of the night, you actually have IL-12, melatonin, and growth hormone get released. Now, IL-12 is one of the interleukins which actually binds the virus and kills it eventually. So if you cut corners in the initial part of your sleep and don't give yourself enough time, you are actually going to depress your immune system and not allow the IL-12 growth hormone and melatonin to be released and facilitate this process. So you're weakening your immune system by imposing your wishes upon yourself that I'm going to stay up late and not sleep early, but respecting the body and appreciating that it loves rhythm, it loves discipline, it loves a certain pattern. And if we allow that to happen, it will actually improve its outcomes. So I would say that sleep well, don't sleep late, 9 o'clock, 9:30, try to be in bed so that you can actually allow these things to kick in. It's like I have a watch, say it's broken, and I go to a repairman and say, well, how long can you take to repair? He says, well, it'll take me 2 hours. I say, well, I give you only 15 minutes. Do you think the repairman will be able to repair this watch in 15 minutes? Of course not. So sleep is a time when a body repairs itself. So let us give the body the time that it truly needs to do its job and not kind of, hijack the time from it. And then who is the one who actually doesn't benefit in the end? We are the ones who actually, end up paying the price for that. So I would urge that please take care of your immune system. And I would also urge each one of you to actually, sleep well. One of the simplest things you can do, just sleep well.
That's such a wonderful, like you said, great reminder. And actually, as you were saying that, we had a question come in asking about lifestyle changes and improvements that would help calm the syndrome. So I think that covers a lot of the key areas: sleep and taking care of your immune system, and giving your body to naturally rebuild that strength, wherever possible. Is there anything you'd like to add to that, or do you think we've kind of covered the key things one can do?
Yeah, for COVID-19, of course, there are many other things. For example, hydrate yourself well. I would say intermittent fasting also creates autophagy that really helps the body. Movement, making sure that you get some sunlight, take, deep breaths, and practicing gratitude. And of course, I would recommend that nature breathe. Doing something called, heart-centered breathing is amazing. So all these little things, mindfulness, go a long way in actually, helping us get better. And of course, from the perspective of actually doing some physical stuff, God forbid, if you have symptoms, then again, like I said, homeopathy is very symptom dependent, and you can take amazing things for each symptom that you're experiencing during the flu, and just not for this pandemic. If you have any cold or flu-like symptoms, it's amazing how effective it is to actually take care of all the symptoms that you're experiencing and allows your body to get back to normal. So they're mentioned on that page, like oscillococcinum, gelsemium, ferrum phos, and of course, vitamin D I would mention over here, because vitamin D, if you take in high doses, it actually creates an antimicrobial peptide. It releases that inside the body. I'll be more than happy to share a link also of that. But literally, it releases a peptide. So if you take high dose, so it actually goes and finds and kills up the virus and eats it up if you take high dose. So it's really considered a hormone, which does so many things and enhance the immune system. You can take vitamin C. You can get glutathione. You can take, colostrum, like, the immunoglobulins per se. So there's so many things that you can do which really support your body, but be proactive rather than be passive.
That's so interesting, actually, that you mentioned oscillococcinum. It's something I came across a very long time ago, and I just couldn't explain it to anybody, but it truly made me feel better, or almost when I started feeling like I was having a cold symptom. I kind of get the seasonal cold. It just 2 days of taking it, I think I took about three doses a day, something like that, and it just wouldn't come at all. It was such a wonderful little secret to have in my medicine cabinet.
Well, as a gift, I can actually give you a whole homeopathic protocol to address the cold flu. I'll be more than happy to send it to you, and you can share that with all those who have actually, logged in, or to other people also in large. It's extremely effective, and I really, rather than take antibiotics and kill your nice gut microbiome, why not just do something simple, calm, and easy? In fact, I recommend one vial of oscillococcinum throughout this pandemic once a week as a preventive thing while it's going on.
Wonderful. That's very kind of you, and I definitely think everyone will be very excited, to see what you would recommend. I know we're running out of time, but there's one very key, crucial question I wanted to ask you. I felt that it's so important with the topic today. You mentioned emotional trauma and somatic healing. Can you tell us a little bit more and how that is important when looking at the whole person and managing somebody with fibromyalgia?
So the mind is so amazing that I could be sitting like this and I have a negative thought. I get angry, think about somebody, and my IL-6 will go up, which is an inflammatory cytokine. So my point is, your thoughts can be toxic. And trauma is something which, a lot of us have experienced at different levels and different grades. And I study, of course, trauma therapy with the Foundation for Human Enrichment, and the technique is called somatic experiencing. Dr. Peter Levine, the founder of this, modality, he actually observed in animals. He worked in NASA astronauts also, and he noticed in observing animals that animals are attacked by predators right, left, and center in the wilderness. How come after an attack, if they survive the attack, they're not sitting like this, all pathetic and not moving and all sad? In fact, if you see a gazelle or something which has just, saved itself, from an attack. It's like pouncing around and it's just jumping around. It's ecstatic. So what he noticed was that, we can have three responses to trauma. We can have fight, we can flight, we can freeze. There's nothing wrong with either of the three responses. If you look at a lion, it has fangs. So typically all those carnivorous, animals which have fangs and canines, you will notice that they all fight. They're all fighters in nature. Hyenas, dogs, cats, lions, they will not run away. They will actually spring at you. Even a little kitten will jump at you, even this little kitten, if it's upset with you. So they will all fight. The animals which are herbivores, but they don't have fangs, like cows and buffaloes and the deer, stuff like that. They are very fast. If you notice, some of them so they will run away. And so flight is their mechanism to preserve themselves. And then look at the poor possum. Possum can't run. Possum doesn't have fangs, so the possum acts dead because it wants to fool the predator. So possum will act dead, like I'm gone, and then it'll actually be able to completely slow its breathing and stop its breathing also, and then fool the predator. But once the trauma or the danger is gone, the animals actually come out of that phase and they actually go through a series of sympathetic and parasympathetic mediated reactions in the body, which bring them back into the normal state. So that is exactly what this technique is all about. It's not psychotherapy, it's not talk therapy. It's really about looking at the body's actually symptoms, but looking at the body, feelings. And we are allowing the patient to be in present the body and actually notice things. And with these resources, then you can actually extinguish the pain, extinguish the trauma. And it's extremely effective. I actually I don't do like sessions per se. There are actually practitioners who do that. But at a personal level, what I do is I, in my first appointment with the patients, typically, what I do is I go through the past detail, and then I basically undo all those attachments and stuff. And it's really liberating for the individual. So please check out Trauma Therapy, Somatic Experiencing, and you'll love it actually.
Thank you, Dr. Saima. We'll take a very last question from our viewer. If you don't sleep well and have tried everything from magnesium and melatonin, what could you recommend to help with that?
Well, magnesium, and I don't know what everything is in your, understanding, but again, if you're not sleeping well, again, it requires history, examination, looking at other elements. But there's some homeopathic medicines called coffee cruda. If you want to try something like that, that can also help. But yes, you can, again, these are all symptoms which are a reflection of something. And just trying to undo the symptom is not the approach, but truly trying to dive at the deep level. Why am I not sleeping? What is wrong with me? What am I missing? What is the psychological or physical, what is behind this thing? We need to uncover that so that the sleeping issue then completely goes away forever, rather than a temporary fix by taking magnesium or some other supplement that you have taken, or even coffee cruda for that matter. Just out of interest, I just want to mention that coffee cruda actually is homeopathic coffee. If you were to drink coffee, what would it do to you? You'll wake up, right? Yeah. That if you take coffee in homeopathic doses, it will actually put you to sleep.
Oh, wow.
So it's amazing that, elements in nature are beautiful. You can literally use them to your benefit. So yes, you can try coffee cruda, but please don't quote me on that, because I think we need to look at the whole of you. Again, look at what your issues have been, and then recommend things accordingly. I have patients with all kind of things. And yes, I recommend certain things, but once we do the testing and we start fixing or addressing the problems, it's interesting how eliminating the things from the root actually results in a more comprehensive and robust, elimination of the issues versus giving some patch medicines here and there.
Oh, wonderful. Thank you again, Dr. Saima. Do you have a closing message for our audience today?
So I would just say for each one of you out there who's listening to me, and I would first want to thank, the Health Bank Global Organization for inviting me here. I'm very grateful to each one of you for having listened to me. And as a gift, I want to offer everybody who has been on this call with us a complimentary session. And as a gift to you, we want to create progress. We want to create acceleration, and we want to create something for you. And my fear is that if you don't say yes to a gift, then you're saying no to your health. You're saying no to your health being optimal. So my hope would be that I don't care about the dream of your health more than you do. And there's a saying that if we have our health, we have 1,000 dreams. But if we don't have our health, we will have but only one. And I want you to keep having 1,000 dreams. And you can contact me through my website. I would encourage you to take action. And if you procrastinate and don't take action, probably things will get lost in the shuffle of your incredibly busy, beautiful life, uh, and you will not reach out for help. So I would recommend that in trouble, shout for help. And if you decide not to, and it's the final time that we connect and communicate, I wish you health, happiness, blessing, amazingness. And I hope for those who do take action, let's take this walk together and grab for everything. And one last thought, we live in a world of opposites, up and down, right, left, north, south, east, west, joy, sorrow. So why would there be a disease and not a cure? So I want each one of you to be very hopeful and not be hopeless. All right. Thank you once again for each one of you, and have a blessed day.
Thank you, Dr. Saima. That's most kind of you. And again, I do encourage everybody to accept this gift and say yes to your health. A big thank you to Dr. Saima for being here with us today, and to everyone who joined us on the session this evening or this morning, depending on where you are, and for submitting in your questions for our session with Dr. Saima today on fibromyalgia. We hope you gained some interesting insight. As always, the websites and description and contact for Dr. Saima will be in the description box below. Wishing you all happy holidays, a happy new year, and see you in the next Wellness Wednesday webinar. Thank you. Thanks, Dr. Saima. Bye. Have a
Bye.
great
You too.